This is Gut Microbiota for Health, reporting from Boston at Experimental Biology 2015. I'm here with Dr. Gary Wu of the University of Pennsylvania. Dr. Wu, what is the promise of understanding bacterial metabolites and how they factor into inflammatory bowel disease?
There's no question that's an area of very intense interest in the field. We started thinking about the effect of diet on the composition, on the structure of the microbiota, and our data suggests that it's maybe relatively modest. But at the end of the day, it's not really the structure of the microbiota, it's really the function. And one of the biggest functions that it actually has are the production of these small molecules that we absorb, many of which have not been characterized. There are thousands of these things. And it's a challenge for us to actually identify what these things are. But it's sort of like mining a very large universe to identify small molecules that might be the next generation of drugs. And when you think about it, these are small molecules that have evolved over time by organisms through evolution. So there is a reason to believe that based on evolutionary development, that these small molecules may be very effective in a way that we would never have discovered independently.
Current IBD treatments suppress the immune system. Is your research, which you presented in your talk today, showing that this should change?
I don't think it necessarily needs to change. I mean, I think that that's our current therapeutic approach. And I have to say that there are a lot of industry partners and basic scientists and academia who are working together to find more targeted non-immunosuppressive therapies for the treatment of inflammatory bowel disease. And I think my point was that there may be adjunctive or alternative strategies to be treating inflammatory bowel disease by changing the environment of the gut, bacteria in the gut, or diet that may make our drugs work better. For example, individuals that don't respond to drugs or they lose responsiveness to drugs, maybe if we change the environment of the gut, those drugs might work better.
At this conference, we've heard about the promise of using treatments for inflammatory bowel disease that act on the host versus those that act on the bacteria. How do you see the future of this evolving?
Yeah, no, I think that at its core, the pathogenesis of inflammatory bowel disease is bidirectional, right? I mean, there's an abnormality of the host, and there's an induced abnormality of the environment. And so that's why this type of environmental engineering of the gut may be a very plausible strategy, because the drugs that we use are trying to modify the host. And if we modify the environment, it might be synergistic, because we know that the pathogenesis of inflammatory bowel disease is synergistic, right? The host has to have a certain compilation of genetic abnormalities. Otherwise, you don't get inflammatory bowel disease. Yet we know the environment is important also. So both things are important for the development of inflammatory bowel disease. I think what we're saying is that maybe targeted strategies, both the host and the environment, would be synergistic and would be a better solution for patients with inflammatory bowel disease.